Early detection is a superior decision. Assalamualaikum and good day to Madam Farah Zalini binti Muhammad Amin and Sir Mat Nizamuddin. I am Nur Amira Shahidah binti Muhammad Amin. I will be the presenter 1.
Hi, I'm Nur Fatin Hanina binti Azmi as presenter 2.
And I am Nur Adila Sarah binti Abdul Aziz as presenter 3.
We are from Group P2S21. We are presenting a study entitled Segmentation of Microclassification in Mammogram Image using Active Contour by Local Gaussian Distribution Fitting Energy. Our supervisor is Madam Aminah binti Abdul Malik.
For our presentation outline, we will cover 12 parts.
Image segmentation is the process of partitioning digital image into multiple image segments. One of the techniques used is active contour method. However, the segmentation process always faces challenges such as weak boundaries, noise, and intensity inhomogeneity. Thus, this study was conducted by using the local Gaussian distribution fitting energy and come up with the best result of accuracy and sensitivity. Thus, this study proved that active contour method by local Gaussian distribution fitting energy can handle all noise and intensity inhomogeneity and used in the texture image.
Breast cancer is in the top rank of number 1 cases in Malaysia, collecting 70.3% compared to other cases. It is the second most common causes of death in Malaysia. Next, for the mammographic, considered as the gold standard for early detection of breast cancer. And as we know, the microclassification is a tiny deposit of calcium that has hoarded in the breast tissue that cannot be felt by detected by the mammogram. Segmentation is a vital stage for further treatment that can separate the foreground of the background as well as separate the most required object from the unimportant one. And as for the active contour model in image segmentation, provides smooth and close contour as a result of segmentation and achieves sufficient accuracy of object boundaries. It can be categorized into two, which is the age-based model and region-based model.
Alright, next is the problem statements. So segmentation can be categorized as the age-based models and the region-based model. So the problem for the age-based model, it is difficulties to detect weak boundaries and sensitivity to the initial curve placements. So for the region-based model, it is easily falling into the local minima, computational complexity, and complicated implementation, and it is also applicable to some images that have severe intensity inhomogeneity. Next is the objective. The first objective is to segment the microclassification in mammogram image using the active contour by local Gaussian distribution fitting energy so that the abnormality can be separated from the background image. The second objective is to evaluate the performance of segmentation results based on the accuracy and sensitivity using the percentage relative error of area between the method and the expert. Next is the significance and the benefits. So for this significance, it is to segment the image with the weak boundaries and the low contrast. This method is resistant to noise image, highly textured image, and the color image. It is allowing it is to easily to extract the desired image. So for the benefit, it is rapid detection that can help the radiologists to detect the cancer earlier.
This study more focuses on the segmentation of microclassification in mammogram image. The data was collected from the National Cancer Society Malaysia that consists of 33 images in PNG format. The process is implemented using the MATLAB R2016S software. However, this study has its limitation where the parameter need to be set manually.
Alright, next is the overview active contour by the local Gaussian distribution fitting energy (LGDFE). So active contour model, also known as a SNACE, is a system for describing an object outline from a potentially noisy 2D image. So the active contour models examine under the level set that may be divided into two types, which are the age-based models and the region-based models. Then, the Wang et al. 2009 presented a new active contour model based on the LGDFE. So the local image intensities are represented by the Gaussian distributions with the various means and variances that are specially varying functions in the LGDFE model.
Okay, next for the applications of active contour model. So, we can summarize that this method has been widely used in many medical image and also color image. However, the study regarding segmentations on microclassification is still rare.
Next, methodology. There are three main phases in this study. Phase 1, data acquisition. Image 1.png was selected as a sample of microclassification. The pixel was generated based on the intensity level of grayscale image. 0 is indicated as black color, while 255 is indicated as white color in grayscale image.
Next, we move on to the phase 2. Phase 2 is image segmentation by using the LGDFE. Step 1, we have to set the initial value of the function. The image segmentation process begins with the setting of the initial values of parameter, which are number of iteration, size of kernel, and the weighted constant, which is b equal to x times 255 times 255. Next is step 2. Step 2 is to identify the initial position of mammogram image. So this image illustrates the result of locating process for initial position of mammogram image. Step 3, we have to calculate the local Gaussian distribution of fitting energy. This is the equations of the complete energy functional, where the gradient descent flow equation can be used to minimize the energy functional. The following is the gradient flow equation. Alright, next is step 4. Step 4 is evaluation of local Gaussian distribution fitting. It is to segment an input image F into object and background regions using the Heaviside function of the evolving level set function as an indicator. So this is the equation of the Heaviside function, which is known as the continuous function and also known as the Heaviside step function. Next is the equations of the smoothing function, which is the derivative of Heaviside function. The last one is the step 5. Repeat to step 2 until all the convergence requirements have been fulfilled. This figure shows image segmentation process with the number of iterations.
Phase 3. Performance evaluation. The performance was evaluated into two parts, which is accuracy and sensitivity. For accuracy, 4 steps were involved. The accuracy was evaluated by subtracting the average percentage error of error by 100. And for the sensitivity, the recognition statistic was used and categorized according to the range of the percentage relative error.
Alright, next we move on to the segmentation result of macro-classification by using the LGDFE method. As you can see over here, this image was segmented by the method. Regardless of how large or a small the size of area, the proposed approach can segment different shape and size of the macro-classification. Next, the body of the macro-classification was effectively segmented even though the image was fuzzy and a lot of noise in the background of the image. Therefore, this LGDFE method achieved our objective.
Next, parameter analysis of local Gaussian distribution fit energy. There are 3 parameters that have a significant impact in this study. Firstly is the number of iterations. The optimal value of image 21.png is 700 iterations. If the value is too low, it will produce the under-segmentation. However, if the value is too high, it shows no difference. This is because the active contour will stop evolving if the current contour position is the same as the previous iterations. Next, size of kernel. The optimal value for image 19.png is 7 since it has a large microclassification. Besides, the optimal value of weighted constant parameter V for image 6.png is 0.001. If the value is too low, the active contour will evolve the entire image. However, if the value is too high, the active contour cannot evolve enough to segment the microclassification in mammogram image. This table shows the range value of parameter used in this study.
Next is the result of performance evaluation. This is the histogram of convergence of average area between LGDFE method and expert finding. From this, we can conclude that the average area between these two does not show significant difference, since both very similar. The average percentage error of area of LGDFE method is only 1.73%. This is the accuracy of segmentation at 98.27%. Next is sensitivity. This pie chart is the recognition statistic and is the relative error of LGDFE method. As can be seen, more than half of the image has a good result. Thus, the sensitivity of the segmentation is 81.82%. As conclusion, the LGDFE method is effective at segmenting area of interest with high sensitivity rate on mammogram image.
Next, we move on to the conclusion. So, the main objective of this study was to segment all the macro-classification of mammogram image. Therefore, the LGDFE method, it can cope with the noise as well as intensity inhomogeneity, and it can be used for any texture image. Hence, the experimental results are excellent with accuracy of 98.27% and sensitivity at 1.82%. As a result, the LGDFE approach has proven to be reliable in effectively segmenting microclassification. Therefore, it can be stated that the active control by LGDFE was effective in achieving all of the study's objectives.
Here is some recommendation that can be proposed for the future research. First, use fully automated parameters so it can reduce trial and error time. Next, Implement the segmentations on RGB image as well as other type of applications of medical diagnostics. Lastly, other structuring elements can be applied such as rectangular, cube and others. This is the reference. Early detection is a superior decision. Thank you. That's all from us.